Hi, welcome to the fourth episode of Richard Harris's Herbal Tutorial. I'm Richard Harris, and in this episode, I'll be discussing the practical and common sense approach behind the use of herb. I repeat, common sense and practical approach to diagnosing and treating disease. I must mention that these podcasts are not a treatise on traditional Chinese medicine called TCM or Ayurvedic medicine. While TCM is common sense and practical, it is not simplistic. It's a comprehensive medical system capable of effectively treating most diseases. The same applies to Ayurveda. They both are theoretically sound, supported by tremendous clinical research. So the concept used in these podcasts are just to explain the theory and thinking that guides the principle. That being said, let's delve into a reasoning extravaganza. Meals were served to a classroom numbering 25 children. After eating the meal, 5 of the children developed diarrhea, each with different symptoms. The diagnosis is food poisoning. Is that a reasonable conclusion, considering the whole classroom ate the same meal and only 5 children are affected? Maybe some children eat more than some. Are we to assume they all have the same disease? Similarly, several persons are coughing. Like the diarrhea, the one commonality in these people is coughing. Are we to assume, like the children with the diarrhea, they all have the same disorder and should therefore be given the same medicine? Let's say one child has diarrhea with burning in his anus, foul-smelling stool, and bad breath. Another has diarrhea that responds favorable to heat. Another has diarrhea with copious stools, maybe with a lot of mucus. Do they all have the same problems? Suppose the people that are coughing all have different symptoms other than coughing. For example, one person has coughing with chest pains, yellow phlegm, thirst, feverishness. Another is coughing with clear phlegm and a little chill. And a third has a weak cough with phlegm difficult to express and a lack of desire to speak. Are we to assume they all are suffering from the same malady? There's one recurring factor in both examples: coughing and diarrhea. All the other symptoms are different. The question is, does simply stating this herb is for this and that one is for that, this herb is for coughing, that one is for diarrhea, isn't it a little like Russian roulette? Let's revisit the examples of coughing. Number 1 is called coughing due to lung heat. The fever, yellow phlegm, thirst, chest pain are all symptoms of heat in the lungs. Treatment: cool the lungs with herbs that cool heat in the lungs and stop coughing. Example 2. The coughing, clear phlegm, chilliness is due to chills in the lungs. The principle is to warm the lungs and stop coughing using warming expectorants. Finally, the tiredness, weak cough, little desire to speak indicates deficiency of the lung qi, as the Chinese call it, or lack of energy in the lungs. Principle of treatment is to support or tonify the lung and stop the coughing. Respecting the diarrhea, similar reasoning, theory, and selection of herbs are applied. The diarrhea with burning in the anus and thirst indicates heat in the large intestines. Diarrhea with cold abdomen, abdominal pains that improve with warmth, indicates chills of the large intestine. The diarrhea with heaviness in the anus and mucus stools indicate dampness or humidity in the large intestine. The next step is to select and administer herbs that address the respective disorder. Please note, the selection of herbs harmonizes with the diagnosis. So cool herbs treat hot diseases, hot herbs treat cold diseases, drying herbs treat damp diseases. When there is deficiency, tonics are administered. Isn't it obvious that saying this herb is for diarrhea and that one is for coughing, this one is for belly pain? Isn't that a little simplistic? What is causing the cough? Why is there burning in the stool? Why do we have chills with fever at times and at other times we have fever with no chills? Where is the diagnosis? Are we supposed to juggle herbs until we get it right? Are we going to be always satisfied with generalities? Shouldn't we be specific? That, my friend, is to stimulate the grey matter in your head and also to acquaint you with a few of the principles that guides TCM, an Ayurvedic medical practitioner, in the selection of herbs to treat disease. This is what these podcasts are about, to give sensible guidelines in knowing how, when, and why we should use herbs. That's it for now. See you soon with another such educational tutorial. If you find this information is helpful, please give it a thumbs up, comment, like, and subscribe. Bye. Have a great day.